This video is brought to you by Nectar.
My name is Desmond, and I am a clinical psychologist here at Annabelle Psychology. A common misconception of coming to therapy is that you're mentally weak. Allow me to offer a different perspective to say that, hey, I'm struggling and I need some help. That's a very courageous step in itself. Unfortunately, we live in a society that doesn't know how to respond to pain. A person in pain doesn't want solution. If the person in pain just needs someone to share that pain with. Another misconception about therapy is that therapy is a quick fix solution. Therapy is not like taking Panadol for a headache. Let's say you are 20 years old when you come in for therapy. Basically trying to squeeze 20 years of your life into 1 or 2 hours. If these difficulties that you have are easy to solve, they would have been solved already. Coming into therapy is all about how can we work together? How can you work together with your therapist to figure out a solution that works for you? For certain kinds of disorders, like for example, anxiety disorders, that there will be improvements between the 6th to the 8th session. For many different kinds of disorders, it is not so simple. There will be limits to that confidentiality agreement. If there is imminent risk of harm to yourself or to other people, the confidentiality agreement might be broken. In most cases, it will never happen without your knowledge. The only clinics that do are training clinics, and the reason why they record sessions is because it's basically for quality control. If you go into a clinic and they say that we record our sessions, you can always refuse and you can always go to another clinic. The main aim of that session is for the psychologist or therapist to understand you a little bit more, to ask questions about your past, to ask questions about what are you currently struggling with. It's really just getting to know you. But at the same time, it is also an opportunity for you to get to know your therapist. In all honesty, there really isn't that much to prepare for therapy other than coming in with an open mind, coming in with an open heart as well. Therapy works its best when we're honest with one another. We're able to let down some of our emotional barriers, where we can be in a room where you don't have to fear being judged by the person sitting across you. This is a very individual and personalized thing. It really depends on what you're struggling with. For example, you've had some relationship difficulties where you're finding it hard to figure it out on your own, and maybe your friends can't really help you either. Or it could be other things like anxiety, like we talked about. Your main aim is that you don't want to feel like this anymore. You want to be able to go back to work. You want to be able to meet your friends again, right? But you just don't know how. And so perhaps these can be your goals in therapy too. I go for therapy, many psychologists go for therapy. Going to therapy does not need to be something that has to be stigmatized. It does not have to represent all the negative things. There is meaning in being able to connect with another human being. We all also deserve a space where we can talk about it without fear of being judged, where we can feel safe, and more importantly, where we can feel like we can be vulnerable.
We hope this video has been useful to you. If you'd like to learn more about mental wellness, do check out our other videos.